Hi, I wanted to come to you and chat with you about morale problems and how morale infects or makes a negative culture in some dental practices. You know, when we get called in to solve this issue specifically, any team issue is usually the phone call we get. I think I can break it down into kind of four big categories. And I want to talk through how to diagnose the problem and the four categories. And then in subsequent videos, I want to talk through how to solve all four of those issues. But first, I want to start with the diagnosis. The challenge with the diagnosis is the problem a problem born of you, the owner, or a problem born that's external of you in the employees? And I think a lot of times, too many doctors, and this will sound pokey, but too many doctors say the problem is the team. And more often than not, I find the problem is in fact the owner or the doctor. So regardless of which of the four categories that we're going to discuss here in a moment, I want you to first look in the mirror and go, am I contributing positively to this, or am I contributing negatively to this particular issue? Or is it a combination, of course? So as I talk through the four issues, here's the kind of the top four that I see. First would be micromanagement. Are you a doctor that micromanages your team? Or said a different way, is your team complacent and they don't have the bar high enough for you to be satisfied with it? So as I think through this one, sometimes what you'll find, and I guess maybe the bigger question is if it's a complacency issue, is it the whole team or is it one person? Or did it start off as one person and then became the whole team as they infected the others, and now as a result, you micromanage the whole team because you're not getting the level of performance that you want out of them? So first and foremost, as I said a moment ago, is it you or is it the team? Is it one person or is it the whole team? And the reason why I'm being specific about this is we've got to diagnose the right problem. We can't solve the problem. We can put a Band-Aid on it, but we can't solve it if we don't know where it originates. So those would be the questions I would ask. And then relative to further diagnosing it, you know, if I think about the term micromanagement, you know, I know some people go so far as to where they're reading every single patient chart, they're changing the spelling errors, you know, really micromanaging, they're double checking everybody's work. That to me would be the epitome of micromanagement. You know, maybe a lesser so version of it is that you're having to ask people if they're doing their jobs. Maybe another version of that might be that you just don't even know if they're doing their jobs. So those are kind of some of the symptoms you want to be looking for to understand, do you have a micromanagement or complacency problem in your office? And again, what's the cause? As an example, are you the last one to show up to work? Are you the first one to show up to work? If you're the last one to show up to work, you're setting a precedent of, hey, getting here late is okay. I mean, I can't tell you how many practices I walk into where the doctor shows up 5 minutes late. You're setting a dangerous precedent with that. So when I then look at the next topic that's an issue, appreciation is something that I run into quite often, where the team doesn't feel appreciated for whatever reason. They don't feel empowered. They're not excited to do their jobs. There's no passion. For them, it's just a job. That, I would say, is probably going to be more of an appreciation topic that causes that problem, where they don't feel as though you like what they're doing. And it could be because they're not doing a good job. It could be you don't say thank you often. It could be all kinds of things. But again, is it an internal problem or an external problem? Are you the source of it? And I realize I'm asking really hard questions, and I'm not trying to be insensitive about it or flippant, but I think if we're not, as business owners, if we're not willing to look in the mirror and ask ourselves, am I negatively contributing to this issue, we're fools. So do you appreciate your team? Does your team know you appreciate them? Do you say that you appreciate them? Where is the source of the issue if it's appreciation? Third, pay. Pretty simple one here. You know, a lot of times you get the issue where one team member feels like someone else is paid better because of whatever information they have, and it can cause a whole lot of resentment around that topic. And the question becomes, do you pay for tenure or do you pay for performance? How do you come up with the pay structure? You know, if you have two hygienists and they get paid a different amount, why do they get paid a different amount? What's your logic behind it? And obviously, in subsequent videos, as I said earlier, I want to solve these issues. So right now, it's all about diagnosing. Right now, the question relative to pay is, how did you get where you are? How did you get to the point where this person's paid this way, this person's paid this way, and why? Understanding that precedent that was set that could be causing issues. And then lastly is vision. The team being inspired by your vision. I have seen great leaders in history, whether dentistry or not, that can inspire and move people. I've also seen people that you could fall asleep listening to them talk. And there's the difference between the two is not only how they talk, but what's the vision that they're communicating to the people. So in your practice, do you have a vision that is very clear of where we're going with this practice, what we're doing, and how we're impacting our patients? Or is it just a job for you? It's a means to an end, and your passion is somewhere else. If your passion's somewhere else and you still have to make a living owning this business, we need to change some stuff. I'm not saying that you need to give up your passion to make your practice your passion, but somehow there's going to have to be some inspiration that comes out of you that the team is willing to follow you. Because if they're not inspired to do their job, now all of a sudden, what's their metric going to be for deciding whether or not they want to stay or go to another job? It's pay. So if you want to decrease the pressure on pay, you're going to have to substitute better vision, being someone who's inspiring to your team. So if you were to go around to your team individually and say, hey, do you know what the vision for our practice is and where we want to take this? Could your team answer it? Could all of them answer it? How different would the answers be? Would the person who's been here for 10 years have a better answer than the person who's been here for 6 months? Or the other way around? So as I think about vision, to me, it's all about understanding how well am I communicating that vision to them? How well are they receiving it? And are they owning it and believing it? That's the question you got to ask yourself relative to vision. So as you sit here thinking about these four, which one resonates with you as maybe the biggest challenge you have? Or combination, of course. And then what we're going to do in the subsequent videos is dig into how do we improve each one of those individually. What are the steps you can take to make and improve this to where then you create a culture in your practice that is completely different than what you might have today? So put a little thought into it, pick the top one or two, and watch those videos next.